Hi, I'm Amy Langan. I am the Chief Marketing Officer at KitCheck. At KitCheck, medication intelligence is at the core of everything we do. Our goal is to provide you simplicity, visibility, and predictability to a complex world of care. Our solutions connect existing and emerging dispensing systems, workflows, and data throughout the product's dynamic lifecycle, giving you a complete picture of the life of a unit dose. Let's dive deeper into what medication intelligence is.
We're on a mission to bring simplicity, visibility, and predictability to physicians, hospitals, and pharmacies through medication intelligence. We take an individual dose, starting at the manufacturer level, wrap intelligence around it, and follow it all the way to the patient. It's the evolution of inventory management technology with full integration and operational insight, providing a complete end-to-end solution from manufacturers to pharmacies to patients. Seamless, cloud-based IT systems that are easy to install, simple to implement, and proven to achieve results. KitCheck delivers accuracy, verification, and time savings. As the leading automated medication tray and cart management system, KitCheck helps hospital pharmacies quickly identify missing, expired, or incorrect medications in each tray, ensuring that the right drug gets to the right patient at the right time and right place. Dose ID is working to create consistency throughout the industry. As a key member of Dose ID, we're helping to establish RFID standardization across all hardware or software systems to ensure optimized tracking performance from manufacturing to implementation. BlueSight provides controlled substance tracking and insights. As the #1 rated drug diversion monitoring solution, BlueSight offers a proactive approach by digging deep into data to analyze risk and mitigate future problems. Using machine learning, artificial intelligence, and data from more than 150 partner hospitals, BlueSight delivers unique insights about your pharmacy's behavior, enabling your team to get ahead of possible risks. BlueSight Insights, a fully automated software solution to help manage costs, people, and processes, streamlining supply chain management, to help you manage your medication inventory and maximize your savings potential. Medication intelligence, integrated solutions that are bringing simplicity, visibility, and predictability to a world of care.
A connected hospital is the hospital of the future. Imagine if data flowed effortlessly from the manufacturer to the patient, providing you an unparalleled view of your medications. Here's where KitCheck's suite of medication solution comes in. Here's an overview of KitCheck, powered by BlueSight. BlueSight for controlled substances and BlueSight Insights can power your pharmacy on a day-to-day basis.
As the director of pharmacy, when it comes to drug management, you're responsible for seeing it all. You're always ready to take action with the goals of saving time, reducing errors, and ultimately ensuring positive patient experiences. Your purpose? Bring simplicity, visibility, and predictability to your world of care. KitCheck, powered by BlueSight, is here to help. Here's how. Imagine you oversee a hospital in Georgia, and your buyer is tasked with purchasing propofol. Unfortunately, it's on back order. With BlueSight Insights, your buyer can readily see what NDCs are currently available. And by using the product and pricing comparison features, she's able to locate propofol pre-tagged with RFID technology at a lower price point than your current supplier, saving you both time and money. When the propofol arrives, the vials are scanned into inventory and stocked in KitCheck's mobile pharmacy. By enabling on-location service, the mobile pharmacy makes restocking faster and easier, with the added benefit of better visibility. With that, you're able to see the propofol is stored and locked in OR1. Later, when the CRNA working in OR1 dispenses propofol from the anesthesia workstation, the patient admin records indicate that only a partial vial was administered. and the resulting waste is not documented in the AWS or patient record, something you want to review, but typically buried under the thousands of other OR transactions from the day. But because you have BlueSight for controlled substances as part of your organization, the solution issues an alert for a potential diversion event with a CRNA. You're instantly able to open an investigation into the CRNA's behavior and determine what happened to the missing propofol. With KitCheck powered by BlueSight, you never once lose sight of the drug, no matter who has it. What if you could manage hospital medication shortages and recalls faster and easier? What if you could also detect anomalous behavior patterns and get ahead of possible risks? What if you could bring simplicity, visibility, and predictability to your world of care? With KitCheck powered by BlueSight, you can. Here's how. Imagine the Joint Commission inspected and wrote up your hospital on crash cart procedure. While the cart itself wasn't set to expire for another 90 days, the surveyor reveals an epinephrine syringe that expired 1 week prior. In order to have real-time visibility from a centralized dashboard, you bring in KitCheck with AeroScout location tracking integration. It's soon realized that the reason for the error was a shortage of your typical epinephrine. Using BlueSight Insights, your buyer is able to source an alternative epinephrine. And because you're using KitCheck, it comes pre-tagged, saving the pharmacy staff valuable time. Plus, they gain efficiency in keeping one source of consistent product. The epinephrine is scanned into the crash cart, providing item level and cart level detail to correct the situation. When the crash cart is transferred, KitCheck seamlessly tracks it from the pharmacy to its destination. Documentation of the cart, its contents, and its expiration is automatically updated, and efficient patient care is assured. Later, when a patient codes with ACS, a nurse attends with the crash cart. To be prepared and with no order, she overrides the dispense of a morphine syringe. Fortunately, the patient recovered without the morphine. Unfortunately, and because of the override, the nurse assumed she could easily take the drug of choice for herself. With the use of BlueSight for controlled substances, the system immediately flags the variance. Because of the early intervention and proactive alerting, the nurse is able to get the help she needs before causing herself or a patient any harm. With KitCheck powered by BlueSight, you never once lose sight of the drug, no matter who has it. Medication intelligence, integrated solutions that are bringing simplicity, visibility, and predictability to a world of care.
If you're interested in learning more information about our solutions, you can visit us at kitcheck.com for more information.